At MedStory, we take privacy seriously and follow all healthcare privacy laws. Some details may be changed to protect confidentiality. The views expressed are solely those of the individual speaking and do not represent the views of their employer.
What was going on in your mind when you found out that you were going to take on that role of the acting surgeon general? Like, it's a huge responsibility.
It was. I had just come back from maternity leave. I had an 8-month-old baby at home. I was sitting in my office, and it was a feeling of disbelief, but also of slight panic.
Welcome back to the MedStory podcast, where we share the stories of the greatest minds in science and medicine. I'm Spencer Locke, and on today's episode, how Dr. Devika Bhushan went from pediatrician to Stanford professor and then acting attorney general for the state of California. And we're going to find out how she made a huge change in our industry. By 2022, California's Office of the Surgeon General was still young, but suddenly it caught the eye of a perfect storm: a global pandemic, a crushing formula shortage, and federal threats to women's health. Dr. Bhushan's response was to cut through that complexity. Her work translated science into direct, actionable care for real families, including teaching clinicians how to treat the hidden scars of childhood trauma through the state's ACEs initiative. But her story isn't just about leadership. It reveals what it truly takes to govern through chaos, and how this one doctor rebuilt public trust by turning cold evidence into deep, meaningful empathy. Now, I want you to imagine, as California's acting surgeon general, Dr. Bhushan found herself balancing new motherhood and a statewide emergency, all while redefining how public health could heal the community from the inside out. And that, my friends, is where our story really begins. So, you went from being a pediatrician and a public health advocate to serving as California's acting surgeon general, which is, honestly, it's one of the most influential public health roles in the country. Can you take us back to that moment when you got into that position and what was going on?
So the year was 2022. The Office of the California Surgeon General had been founded just 3 years prior to that in 2019. And I'd come in as the office's chief health officer, which meant that I was really in charge of looking at the research, the clinical underpinnings of all of our work, much of which was on how to heal from childhood trauma. And then when I stepped into the role of acting surgeon general, it was, as you can imagine, middle of COVID, very active, busy time in public health. And the role of the California Surgeon General is really to be an external messenger on all things public health. And so at that time, it was COVID. It was the infant formula shortage. It was interfacing with federal efforts around the upcoming abortion ban. It was looking to protect different rules and programs and regulations that we had in place in California to both solve for the problems of the moment, but also to help prevent worsening of crises that we knew were coming. And so it was a really pivotal time to be in that role. So I alluded to the bread and butter work of our office was really in setting up the ACEs Aware initiative. And that was an initiative that went live in 2020 in California, which really helped to give healthcare providers a way to think about how to treat the health impacts of childhood trauma. So we had a training, we had a mechanism by which people could be reimbursed for screening for childhood trauma and then doing something specific to treat those impacts, whether they were seeing a patient who had diabetes or heart disease or depression, to really understand the role that dysregulated stress biology might be playing the development of that disease and its course, and really trying to unravel those impacts by doing things like spending time in nature, having an anti-inflammatory diet, getting better sleep, getting better exercise, or getting into strength training, things like that, things that are really within the scope of any healthcare provider and patient relationship and are really within the scope of what a person can do for their own health. And so really empowering people. 2/3 of us have experienced something that might be considered traumatic in our childhoods. For example, having a loved one who was in jail, growing up in poverty, living with someone in the household who had mental illness that might not have been treated adequately or appropriately during the time that we were growing up. And all of these things can leave a biological residue on our bodies, and the mechanisms by which we, for example, our hormones, our immune system, our metabolic systems, all of those things can become misshapen and dysregulated by being affected by chronic stress. And there are ways that we can actually bring those systems back into regulation, back to baseline, and much healthier, and then thereby just decreasing our risks for a whole host of health problems, both now and in the future. And so that was really the focus of that initiative. And in the middle of COVID, 2020 came, and suddenly everyone in state government and in government of all kinds, we were all looking at having 3 different jobs, right? How do we stem the spread of COVID and all of the impacts from all the mechanisms of social distancing that we had to put into place? And how do we make sure that we're in a place as a society where we're really lifting up resilience and prevention at a time where everybody really needed that?
This sounds like it's obviously an incredibly powerful program, but what was going on in your mind when you found out that you were going to take on that role of the acting Surgeon General? Like, it's a huge responsibility.
It was. And it was not necessarily a role. What was going on in my mind when I heard that my then boss, Dr. Nadine Burke-Harris, had decided that her tenure as as Surgeon General, as the first Surgeon General, was over, and that she was transitioning out and that I would be stepping into this role. I had just come back from maternity leave. I had an 8-month-old baby at home. I was living in San Francisco at the time, and I remember where I was sitting. I was sitting in my office, and it was a feeling of disbelief, but also of slight panic, right? Like, oh, okay, this is going to be a major change in my day-to-day, and it was going to be much more of an external-facing role than I'd ever held in the past. A lot of the role is issuing public service announcements, being on stages, doing keynotes, helping people really understand what a particular public health message or program was really all about, right? Really helping to translate public health and science into lay speak. And I realized that was much of what I had been doing my entire career. As a practicing pediatrician, a lot of what you're doing is helping families really make sense of what does the science say and how does that apply to me? And in my particular situation, my child's particular situation, what are the best ways to think about improving our health? And that was those conversations and then work I'd done in writing and synthesis of this kind of work in journalism. It was all about how do you tell the story and how do you help people understand and make sense of what's happening. And that part of it actually felt very natural, and it was a very exciting time.
It's like such an important skill set to help educate the public on that. But we went through this period, and still frankly are, where there is a level of distrust still present. Where do you think we may have gone wrong, or maybe areas that we can improve on with that?
And honestly, Spencer, we're talking at a time where the level of trust in public health and in health in general is at an all-time low in this country by many metrics. And a lot of that is we have seen the folks who are at the highest levels of power in our country right now, including our president and including our Health and Human Services Secretary. The folks who are in those positions right now are really bolstering this anti-science and feeling and sowing mistrust, actively sowing mistrust in our systems of public health, including the CDC, including the vaccines that we've long trusted in medicine and public health to prevent disease and prevent real suffering. I grew up for part of my childhood in India. Polio the impacts of polio can still be readily seen. If you go to any railway station in India, so railway is a major source of public transportation all over the country of India, but on the platforms, you can still see people who have been affected, whose bodies have been affected by polio. So they might be missing a couple of limbs. And that is something you can see in every single city that I've ever been to in India. And I lived there until I was 6 years old. And frankly, we live in a country where we are largely protected or shielded from the very devastating impacts that vaccine-preventable diseases can have. Although now we're starting to see the reemergence of measles, right? We had eradicated that in this country, but this year we've already seen 3 deaths from measles. And I think it's not until the real specter of vaccine-preventable diseases is able to be seen and felt that we're really going to understand at a gut level that what we fear and what we've been led to fear falsely from vaccines is actually pales in comparison to what those diseases can actually do to our bodies and to our communities. But yeah, you're right. We're living in a crazy time for public health.
We really are. And I think what's so amazing to me is that I think originally I was living in a bubble thinking people must care about what the evidence says. Like that must be what most people care about, and they're going to follow that guidance. However, it's became or made clear that this is not the case for a lot of Americans. And it makes me wonder and say, well, what do we need to do as a healthcare community to get out there and continue to combat this thing that's becoming so harmful, not only for our health system in general, but also our public health population?
Yeah, we live in a time where the messenger matters much more than the message, right? So it's how much do I trust and believe the words that are coming out of one person's mouth versus another? And the fact that we have so much trust in untrustworthy health promoters, for lack of a better word, people who do point to true problems with our system. For example, the system is not working for people the way that it should. That is something that no one can deny. And the problem comes when these health promoters and influencers point to they point to this sort of like naturalistic bias that we all have, right? And they say, okay, if you take these supplements, which by the way, I'm part co-owner or shareholder in these companies that I'm promoting, then your health will be much better. And the truth is that people tend to believe that things that come from nature are likely to do less harm than things that are manufactured. But if you think about it, most toxins that we know of, botulinum toxin, arsenic, are naturally occurring compounds. And we just lose sight of that. And we tend to think that, okay, food, supplements, things that are outside the purview of the Food and Drug Administration to regulate, those things have just benefit without having side effects or harms. But the truth is, anything you put in your body, regardless of where it comes from, whether it's a food, whether it's a supplement, whether it's a medicine, has both benefits and side effects or drawbacks. And I think we have to have a much more nuanced and deliberate conversation. And we do have to put the right messengers out to combat all of the misinformation and disinformation that exists right now. And disinformation is when somebody actively misconstrues the data and the information to falsely represent the facts. So it's an intentional stretching of the truth. It's an intentional mischaracterization of the truth, which is a lot of what's happening in politics right now.
So how do you communicate it? So say I come to you and I say, I heard from the news that Tylenol, or this vaccine, is going to give me or my child autism. How do you respond to something like that?
So I think that you have to start with where those beliefs came from. So I always start with questions about, where did you hear that? Have you heard that before? How did you feel when you heard that? Do you believe that? And what questions do you have about it? So really trying to understand, is this just something that, came up because the president said it and it's now inspired a lot of questions? Or is it something that somebody has been believing for years and somebody said it and corroborated a belief that was already pre-existing, right? So that helps you understand where somebody is with a certain set of beliefs. And then you move to the values and the goals that you have in common, right? So in the context of a pediatric clinical visit, that is the kid's well-being and what's going to happen next for that child. And usually the clinician and the parent is on exactly the same page about that. And the ways to get there, those things might be different between the two parties. And that's, you start with a common ground and then you build from there. And I think facts have to be couched in a sense of care and a sense of empathy and a sense of wanting to listen and understand the other person's perspective. And so when I do bring in facts, it's after I've already gotten a sense for what somebody cares about, what they believe, and why they believe it. And then I say, okay, I'm hearing what you're saying. Here's what I've learned. And I always give a source. I always say there was a study done in this population. For example, there's a study done that showed that Tylenol during pregnancy is not associated with any neurodevelopmental impacts in children. And I always say, here's when it was done. Here was the journal it was published in. And I often, if it's an online conversation or a message, I will send them the link to it so they can suss it out for themselves and understand how it was constructed and what kind of data, what quality of data it really was. But at the end of the day, I think what really helps bridge conversations where one person has a point of view that is very different from the other, that willingness to listen to and understand the other person's perspective. Because when somebody feels seen and they feel respected, regardless of what their perspective is, they then have a certain openness to understanding your perspective in return and perhaps renegotiating the way they look at truth.
That is put so beautifully, because I think that oftentimes physicians, they're very evidence-based. They want to just show you the data and say, hey, here's the data. Here's why we're making these recommendations. But if they approach that communication in that way, the person's just going to shut down because they, number one, probably feel like you're not hearing them, saying like, listen to what I'm saying. And I think that it's now becomes the challenge is like, yeah, this is really good in theory, but now tell a physician to do this in the 7 minutes that they have with their patient.
It's impossible to do in the small amount of time that especially primary care physicians have to address a myriad of health issues, a myriad of social issues. And now with pediatricians being asked over and over to stand up and defend a practice that has been so entrenched in our work and so evidence-based. And I think there's a lot of, honestly, burnout around this because there just truly is not the time to do it in the empathic and correct way that most of us want to do this work.
What do you think some of the best solutions for this is?
So I think that for sure, people talking to their physicians directly, to their nurse practitioners, to their clinicians directly is part of the solution, but it can't be all of the solution. So I think the work of these practice organizations such as the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, the American College of Family Physicians, the American Association of Family Physicians, AFP, these kinds of practice organizations that really help to establish the policy directions of the entire specialty as a specialty nationally. They also help to establish guidelines for treatment of different kinds. And then they also have very active social media and externally facing blogs and other instruments to really get the truth out to the public in a way that's readily accessible and digestible. So, for example, the AP, which I work with, the American Academy of Pediatrics, has a website called healthychildren.org, which is its parent-facing website. And anytime anything comes out about measles and vitamin A or the COVID vaccine or anything, this entity within the American Academy of Pediatrics comes out with content that sets up the truth, sets it up in a way that helps to debunk some of the myths and the misconceptions, and makes it very easily accessible with links to primary sources, which I think is also key for people who want to go to the primary data, who want to dig deeper and really get to the facts.
With some healthy criticism here, I agree, and I think that it's really good that these organizations are doing it. Now, the question is, are they doing it well? Because I think they've tried for a long period of time, but it's been ineffective because they're going from the sterile, like, I'm just going to sit here and educate you approach rather than changing with the trends that are just common within media today. Do you think they're a little slow to adapt to something like that?
I think that is a very fair point of feedback. And I think that there are a lot of individual influencers who have the right takes on health and well-being, who are increasingly being partnered with. So the American Academy of Pediatrics, for example, has started to do collaborative posts on Instagram with patients with large followings who have the right stance on health and well-being topics. And so I think being creative and collaborative and thinking outside of the old box, if you will, is really going to help these organizations stay with the times, and I think it's starting to happen. And I agree that they haven't always been at the cutting edge, if you will, of innovation as far as information dispensing and the latest ways to do that. But I think things are starting to shift.
I think so too. It's never shifting as fast as we want it to, but I think we're starting to wake up as a healthcare community to be like, we've got to change something here because the narrative that's going out is just not hitting like we need it to hit. But slowly leaders are emerging into this space, which is really cool to see. Now, with your experience as a pediatrician and a public health leader, do you feel that the current day, is this going to lead to some sort of trauma or challenges in our children today? And are we currently failing our kids as far as the way that we're approaching their health?
I think that we are increasingly looking to non-data-driven sources of truth, as we talked about, but also non-evidence-based answers to solving for health, right? So things like unregulated supplements or taking dyes out of our consumption, out of our food supply, for example. We are potentially to reach for solutions that actually will not have the impact on health that we're all hoping that they will. And yes, so if you think about what that's going to mean 5, 10, 20 years down the road, if we pursue the wrong policies at a systems level, right, then we are embedding essentially in a policy framework, we're embedding the wrong solutions. And so the kids of today will see that tomorrow because we haven't gotten to the right solutions from a policy standpoint. And does that create trauma? I think that when it filters down to the individual, it can and it does. So if you have a parent who has started more recently listening to some of the zeitgeist about anti-vaccines and has started to say, hey, I'm going to take my kid out of school, or I'm going to issue a non-medical exemption to vaccines and still keep them in school. And if your kid then gets sick, or if your kid sees a community member fall seriously sick and be forever changed by an illness that could have been prevented, that kind of stuff, that has real traumatic impacts. Because at the end of the day, that child might grow up and think, hey, my parent made the wrong decision, and I wish they wouldn't have done that. And no parent is ever going to be perfect. That's not what this is about. We are all, as parents, going to do things that our kids are going to look back at and say, that wasn't the right thing to do. It's not about not making mistakes. It's about having the integrity to even look at your own beliefs and your own decisions that impact your children's health in a way that is nuanced and is able to shift if you are evidence and opinions in a respectful, compassionate way that are actually going to make the health and well-being of your family better. I think that ability to shift is going to be what saves us. And it's a really hard thing to get somebody to do, is to examine their own beliefs and realize that there is room for something to improve or to be more accurate.
That's a really good point. And this actually brings us back full circle to, in the beginning of this conversation, you were talking about the implementation of that ACEs program that you helped develop. My question really is what did you or your team identify that made you say, oh, we actually really need to do something about this now?
So if you look at any population in the United States, about 2/3 of U.S. adults will say, hey, I've experienced a traumatic event in my childhood. And we also know that adverse childhood experiences, or ACEs, are associated in a dose-dependent way, which means the more of them that you experience, the greater your risk for 80 different health conditions, anything from heart disease to cancer to infections, to, of course, mental health impacts of all kinds. But essentially, you name a health outcome, and its risk at the population level is affected by the number of traumatic events in your past. And the missing link there is that those events change your stress axes, right? And they change the way that your body's nervous system operates, your hormonal axes, your immune system, all of your metabolic processes can become dysregulated as a consequence of stress being present all the time and your stress response being on all the time, not being allowed to come back to baseline. And those things then get shown up in earlier and harder to treat chronic conditions and acute conditions of all kinds. And when we miss at the root cause, the underlying root cause is actually dysregulated stress biology, we miss the opportunity to more specifically treat what's going on for a given patient coming in with, let's say, early onset diabetes, early onset heart disease, depression that's really hard for the person to treat, right? That isn't responding to conventional treatments. A lot of times what we're missing for so many people is a way of re-regulating their stress axes. And so what we decided to investigate and to help promote through this program was really educating clinicians first and foremost that stress biology was likely to be playing a role in a majority of the health conditions that they were coming into contact with on a daily basis, and specific tools to give back to the patient that they could employ to help remedy what was truly at the root cause of that diabetes or that heart disease. So things, learning about anti-inflammatory nutrition, really re-regulating all of the metabolic systems that might be dysregulated by the food that we are putting into our bodies, helping with exercise regimens, time in nature, which is really soothing and healing to the nervous system and really re-regulates all of those axes that we talked about, having time with the people that we love and care about, having meaning and purpose in your life. All of these kinds of things really help systematically correct the impacts of dysregulated stress biology and can actually more specifically treat the diabetes that results or the heart disease that results, rather than just coming at it with a one-size-fits-all, because many of the guidelines, the clinical care guidelines, miss this root cause of much of what is happening to people.
How do we identify what is and what isn't a traumatic event? Because I've heard that these kids, some have them, but parents have almost like flipped the script to where now they're raising like soft children. They're not like challenging them. So I guess, how do we find that balance? But first off, how do we identify like what is a traumatic event for them?
So a traumatic event really has to have an impact on the person who experiences it. And the thing about traumatic events is that what's really traumatic for me might be not very traumatic for the next person. So it can be very individual. But generally speaking, it is an event or an experience that has a longer lasting impact, and biologically speaking, that puts the biological stress system on overdrive and on high alert so that it's much more readily reactive to future instances of stress. So for example, let's say you as an adult are in a situation where you witness an attempted burglary. That would be a much more stressful event and a much more traumatic event for you if it also created memories of prior experiences that you had that had been similar. Whereas if it was somebody who had never seen anything like that, it might be differently traumatic or less traumatic, although these things are very tricky. But essentially, it has to do with the impact that it has on the person, right? And it's not about the event itself or the experience itself. It's really about how it's experienced by the person. And then I would say to this question of, are we going the other way? Are we being too soft on our kids today? I think that a lot of parents in today's generation actually have difficulty tolerating the discomfort or distress of their children. And that's the real issue. It's that we are over-rescuing children from difficult or challenging circumstances that they actually need to experience to be able to the intrinsic mechanisms, the coping skills, and the resilience to know how to navigate stressful and hard circumstances in the future, right? So when we, like, just small example, right? If you have a little child who's just learning how to tie their shoes, instead of letting them struggle through that and figure it out, you swoop in and help them every single time. You're robbing them of the chance to learn that, one, they can figure things out on their own, and they can do hard things on their own. And you're robbing them of the idea that you trust them to do things like that on their own. So it's only by doing hard things, by actually walking through stress, that we earn the capacity to turn our stress responses on, dial them back to baseline, and then be able to deal with ever-increasing sources of stress or hard and uncomfortable things through the rest of our childhoods and adulthoods. So I think what's happening now is, yes, we are, quote, being easier on our kids, and we're being very mindful of what could be traumatic and what could be too stressful, but we're also losing sight of the fact that we actually all need to experience healthy, manageable doses of stress in order to develop resilience.
Progressive stress is good for our body, right? It's when it's repeated and over a chronic period of time, that's when we have chronic exposure to our cortisol, and that's where all that dysregulation can happen. When you were speaking, it got me thinking about a coaching framework where we talk about confidence and capability. So sometimes a child may be very capable of doing something, but they just don't have the confidence to do it. And vice versa. One thing may be, they may be overconfident, but they're not actually capable. And so depending on what it is, should determine how you're going to coach them, whether you're with an adult or with the kid themselves, rather than just stepping in and doing it for them because you're robbing them of that opportunity to learn it themselves.
Yep. And what a kid is capable of is shifting every single day. And so part of parenting is also knowing where they are in their addictive capacities and helping them sort of shape, being at the growth edge all the time, right? Parenting is a lot like coaching.
For sure. And so for you, as someone that has now made this incredible transition going from doctor to public health to advisor to now author, can you talk about what this book is that you're coming out with and maybe the motivation behind it?
Yes, absolutely. And so I'm working on a series of books for children with a co-author, Dr. Bruce Perry, and we're co-writing a series of books. And they really have two different audiences, right? So this is meant for parents as well as for kids. And we're embedding central messages about stress and resilience in these books to help parents understand, how do you navigate those really stressful big moments in early childhood in ways that are actually helpful and help your kid develop resilience longer term rather than hindering that. And so I won't give too much away, but the stories are about dragons. They're about a family of dragons, and they move through different challenges in every single book. So the first 3 books are really for youngest age group, so 2 to 5-year-olds and their parents. And then the second group of books is for the 6 to 10-year-old population and their parents. So the challenges get ever more complicated and much more targeted to the different age groups in the 2 sets of books. And we're just really excited to get these out into the community, get parents reading them, get schools and reading them as well.
Why? Why did you decide to do this?
So here's the thing. There are a ton of courses, books, and other really time-intensive resources that are high quality and available. The truth is, when you're in the throes of early parenthood, you don't have time. You are time strapped. But you do have time, usually, to get your kid through a bedtime routine, which often involves a book or two. And so wouldn't it be so amazing if that time that you spend with your kid reading that book could give you and your kid some lessons about how to make life a little bit easier day to day and longer?
It makes a lot of sense. And based on the conversation that we had, it seems like it's good timing to have a book with your background too. That is really unique. And just to open the door into your background itself, this is something that you've talked about growing up with, or I'm not sure if it's growing up, but you've talked about bipolar disorder and your
Yes.
personal relationship with it. Can you tell us a little bit about maybe when you were diagnosed and your experience with?
Okay, absolutely. So I live openly with bipolar disorder, as you alluded to, and I decided when I was serving as the acting surgeon general that I wanted to speak publicly about this for the first time to really help normalize and destigmatize living with serious mental illness and doing what you would like to do still with your life, even if your goals change as you learn how to manage it. So I was diagnosed in my early 20s, like many people are, and it took me at least 3 years. I was in medical school, so I was an insider, if you will. But even so, it took me 3 years to get to the right diagnosis, to get to the right treatment plan. And that's very typical with bipolar disorder. People can take up to a decade from the first time they have symptoms to the time that they receive the right kind of help that they need, the right diagnosis and the right treatment plan. And that's really pivotal. We really have to shorten that amount of time. And I think we're starting to do it by moving toward more mechanistic understandings of what's actually happening. At the root cause, mitochondrial dysfunction, neuroinflammation, other metabolic parameters being deranged. If we get to a place where we understand those mechanisms closely enough that we can start using biomarkers to both diagnose people early, track their progress and their episodes in a way that where we have objective correlates to the symptoms and the experiences that people have. Those are the kinds of things that are going to really shift the paradigm as we know it for bipolar disorder. But it is still a very stigmatized and very difficult illness. And so I wanted to do my part to help it be better understood, to help it feel more accepted.
Was it scary going public with this information?
I thought a lot about it, and I thought about it for months for sure, but almost a couple of years. But what I realized for me was the longer I lived in a place of wellness with this illness, that sounds like a paradox, but the more time I had where I figured out how to manage this illness, the less of a hold it felt like it had on me. But at the same time, the more comfortable I became in letting other people into this part of my life, people I was working with, people I was friends with, people I was in community with. And it started to feel, especially in 2022, in the middle of the pandemic, that everybody was struggling with something. And it started to feel just much more authentic to bring this conversation out into the open and just to open the door to say it's okay to have stuff that you've struggled with and to know that's been a part of your story and that it actually helps you once you've walked through something really difficult to know, first of all, what your own boundaries and self-care strategies need to be so you can be the best version of yourself. But also, it really helps you. It shapes the kind of leader that you are. It shapes the kind of physician or public health practitioner or parent that you are to really have struggled and to come out from it, because it builds the kind of empathy and appreciation for the full spectrum of what humans can go through. And it makes you just that much more compassionate, real when you're helping anybody with anything.
When I was coming up with my company name, MedStory,
Yeah.
that was one of the primary drivers. It's hard to get healthcare professionals to share their story.
right?
Professionally and personally. And having talked to amazing people like you, it's only doubled down on my conviction of how powerful that is. Because you think of anyone that comes across you who sees an incredibly high performer and then comes to find out that you've been dealing with bipolar disorder. You know what that does for so many people is it makes them feel like they're not alone.
Yeah.
And that's the
right.
power of it. It's so incredible. So I have so much admiration for you because I imagine that it's a very scary thing to do, but the fact that you're doing it is honestly impacting so many people. So thank you for doing that.
Thank you for saying that. And there were many people I looked to as examples before I did it too. One of my friends, Dr. Justin Bullock, did it when he was in residency, which is a really hard time to be public about something like this. And he was one of the heroes I looked to in my own journey to help normalize my experiences and to then be public about them.
Wow. So I always like to end these conversations with, if another healthcare provider is maybe struggling right now and trying to figure a way to get out and create opportunities for themselves, what do you want to say to them?
First, I would want to say that you are not alone. Most of us in medicine have struggled in one way or another. And the truth is that we have in this culture, in this profession, a culture of toxic perfectionism. And so we all project an exterior of no chinks in the armor, completely buttoned up and put together. And that's part of our training, where you show up to work even if you have been up vomiting all night. You show up to work. You don't make somebody else take that shift. But I think that truly we need to start unraveling tendencies and to really start honoring the humanity and the truth of the suffering that we all hold, whether that's vicarious trauma through the stuff that our patients have told us, whether it's things that have happened in our own lives or our family members' lives or loved ones' lives. There's hard things that we've all walked through. And I think the more we can normalize talking about it, true, authentic connections with other people in the profession and outside of it, the more we'll realize paradigm of buttoned up white coats with no wrinkles or tears in the fabric, that is just not serving our profession. And it's definitely not serving the people who are in our profession. And I think we all just need to be real and own our humanity.
Well said. Well said. That is beautiful. So if someone's listening to this and they're like, you know what? This woman's awesome, which I agree. Where could they go to learn more about you and maybe even stay in touch with you for when this book come out?
Well, the best way I think would be my Substack. It is askdrb.substack.com. And so anything I write, any op-eds or other pieces will appear there. I'm also on all social platforms as Dr. Devika B. So DRVIKAB. So you can find me wherever you happen to log on. And I'd love to stay connected.
Amazing. Well, thank you so much for taking the time to sit down with me. I know so many people are going to get amazing value from this, and you really are a light in this field.
Spencer, thank you so much for having me. This has been really fun.
Thanks for listening to the MedStory podcast, where we share the stories of the greatest minds in science and medicine. I'm your host, Spencer Locke, with a special thanks to our executive producer, Shaina May. Our music comes from Blue Dot Sessions and the Descript Audio Library. The MedStory podcast is made possible by MedStory Studios and listeners like you. So if you'd like to support us, please leave a review. It means more than you know. And if you have a story to share or want to produce a podcast of your own, reach out to us at info@medstorymedia.com. We'll see you in the next episode.